have you treated victims of motorcycle accidents?
I have. In fact, one of them was my husband.
Oh God! Oh, I'm so sorry to hear this.
He's okay though.
Yeah.
A little hiccup.
When
but
did this happen?
It was about 2 years ago.
Oh wow! Oh, I'm so
Yep.
sorry to hear this. So, how badly was he hurt?
Wasn't too bad. A little shoulder issue. He had a little bit more scrapes and stuff like that.
Yeah.
But he was okay.
Right.
He wasn't my favorite patient though.
So, do you see?
But I have had a couple others. But
Yeah.
he's the most special one.
The most memorable.
Oh yeah.
Welcome to Riding Counsel with Rich Jaffe, where the open road meets expert advice. I'm Richard Jaffe, an attorney and biking enthusiast, and this is the podcast where we dive into the world of motorcycling, safety, culture, charitable giving, and riding right. So, whether you're a seasoned rider or just getting started, let's talk bikes, the road, and everything in between. Let's ride! Hello, everybody. So we are fortunate enough to have a wonderful guest with us today, and I don't think she needs any introduction, at least from me, so I'm going to let her introduce herself. She's going to tell you her name and what she does, and with that said, take it away.
Hello. How are you? I'm Christina Auriti. I am a physical therapist and friend of Rich's. I think after X amount of time, I consider myself a friend now. And Rich and I have worked together for a couple years, and here we are.
We have known each other for a long. It's got to
10
be like a
years.
decade or something. I was going to say.
least.
But I'd like to start right away with something really important. What earrings are you wearing? Who makes those? Because those are amazing.
I don't know. I think my jeweler made them.
Okay, they're
Give a
really
shout out to
amazing.
him.
Okay, shout out to
Thank you.
Mr. Jeweler, but they're really
Thank
nice.
you.
They're very compliment. I don't know. I don't think you're a physical therapist, you said.
Yes, I am.
So is that a thing? Like physical therapists have to wear earrings to be effective?
No, not typically.
Is it something having to do with acupuncture?
Not really.
All right. It's just.
Maybe dry needling, but not acupuncture.
Okay. All right. That's good. This episode has been brought to you by Riding Counsel. Don't forget to visit us at ridingcounsel.com. So we say physical therapist, like we're throwing around the term, right? But you got to do a lot to be a physical therapist,
Yeah.
right? You start out, well, where'd you grow up?
So I grew up in Franklin Square,
Yeah.
and I knew around, I'd say, like later on into high school, that I wanted to do something athletic. So initially I thought like athletic training. Hey, this is cool. I get to work with athletes. My guidance counselor was like, maybe you want to try physical therapy. It might be a little bit more stable, a little bit more rewarding. You're in the medical field.
Right.
So I said, okay, sure. Didn't know anything about it. Volunteered for, 3-4 months.
Right.
And I was like, all right, this is what I want to do. Applied, got into NYIT. They have a combined program. So you're in for 3 years undergrad, 3 years graduate. And
That sounds intense, though, because 6 years.
I
you
honestly
gotta do a
I didn't
lot.
think it was going to be as difficult as it was.
Yeah.
But there actually is a lot of medical knowledge that you need to know.
Right.
Not to downplay them, but we are not a personal trainer. We are a trained, licensed medical professional, and there's a very, very big difference between the two. And it shows in treatments. It shows in just the path of what people use us for, like rehabilitation. We're getting all of these patients back up and ready to eventually go to a trainer, per se. Yeah, you
So-
have some that overlap, but
You're a doctor of physical therapy, right?
yes.
So that's more than just a physical therapist, I'm assuming.
Yeah. I mean, mostly, I want to say, I think from 2000, you have to have your doctorate in physical therapy as a graduating student, which is cool because it gives us the ability to have something like direct access. So direct access is if a patient is like, oh, hey, I hurt my neck. I'm going to go to physical therapy instead of having to go see a medical doctor, get a prescription, do that whole thing.
Right.
It's still annoying because we still, for insurance purposes, require a prescription
Right.
after 10 visits or 30 days. But at least they can get kick-started with PT without having to go wait for however long you have to wait to make an appointment with a doctor. And then, so that process just gets pushed back, by a couple weeks, depending.
Right. So at least it's another choice for a patient who needs services, and they don't have to wait for okay, our next appointment at the doctor's office is in 5 weeks from now, and then they got to wait.
Right. So
now
they're
they
sitting
can go right to
here
you.
5 weeks in pain.
Right.
I'm sure they'll probably seek other options at that point, but still, that's a realistic, scenario that happens.
Right. So where is your office?
We're right over in Great Neck, so not too far from here, right on Northern and Lakeville Road.
How many beds do you have over there?
5 or 6.
So it's pretty sizable.
Yeah. I've been there. I started working for a different company there, and then after 6 years, I had taken it over to be my own. So I've owned it since 2018. So we're coming up on our 5-year in March, and it was the best decision I ever did.
Excellent. So you're like a small business owner too.
Yeah.
So, okay. So we're throwing around a lot of terms, physical therapy, but can you talk to us about what physical therapy really is?
So physical therapy is basically a PT sitting here assessing your movement, your strength, your body mechanics, how you walk, gait analysis, and a lot of those things can be affected by muscle imbalances, weaknesses, stretched muscles, tight muscles, ligamentous imbalances, and we're basically a movement specialist. So we specialize in body movement, which is how I got my company name.
Right. So your company name is Body
Movement Physiotherapy. Yeah, because that's what it is.
Right. So you see all kinds of injuries, I'm assuming. Is there anything you don't see as far as a physical injury? Like you say, hey, I can't handle that.
I would say personally, I prefer to refer out peds, pediatric patients. Although I have 2 kids of my own, I just would feel more comfortable having them go to someone that specializes in pediatrics. And pelvic floor. I don't do pelvic floor, but there's a really big market for pelvic floor.
That's a separate niche.
Yeah. And really important too. I think that has really, that field has grown in the recent years. I just think women being more educated and maybe women having a little bit more of a voice as to say, hey, this doesn't feel good, or I feel weird doing this, or I can't do that. And to some degree it could be uncomfortable, but if you have the resources available to you to fix it, it makes it that much easier to take care of it.
Right. Okay. Well, part of what you do is you help people who are victims of car accidents.
Yep.
Okay. So a lot of people come through your doors, and some of those people have been clients of mine who are victims of car accidents and other kinds of horrible things happen to them. How about limiting yourself to something insofar as the trauma world? Do you say, hey, I'm not going to handle these kinds of cases, or these other kinds of cases over here?
I'd say no. I mean, there's always something that we can do for the patient, unless they're severely, disabled at the time, temporarily. Maybe they would be a better candidate for home care.
Right.
But that's the only way I don't want to say shy someone away, because I wouldn't, but it would be better for that patient to be doing some PT at home, because just getting out of the car and getting dressed and getting to the office can be enough of a task for them. Right. But once they're at the office, all bets are off.
So somebody can come to you. They don't have to go to a doctor's office. And we've talked a little bit about the advantages of that, because they don't have to wait for an appointment. But also I'd imagine that a physical therapy office like yourself, it's probably a little more comfortable for somebody, and maybe they don't have so much of a wait even in the waiting room. Yeah, we try and get them in and out as quickly as possible, but giving them the care that they need. I treat my office like I'm at home. I am very comfortable there. I'm easy to talk to. I will sit here and talk to any patient. I've had them tell me things that I
never thought they would ever tell me. And then, sometimes I'm trying to pull information out of them, but we try and make it very comfortable for the patient because they'll be more inclined to listen to you, to do their exercises, to be compliant with therapy, because just like anything, you go once or twice, there's only so much you're going to get out of it.
Right.
If you're not compliant with it.
Right.
And consistency is key with that,
And I imagine when somebody goes to a doctor's office, for instance, they'll talk to the doctor and the doctor will assess the patient, but something like physical therapy, maybe you can actually help them that very first visit.
Right. And the good thing about patients coming to PT is like they're coming multiple times a week. We see them 2 to 3 times a week. You go to see an ortho or a neurologist or whatever doctor, you go see once every 6 weeks, 6 to 8 weeks. So like we build a relationship and we build a rapport with that patient, and that's really important because, like I said, if you can get that patient comfortable enough where they don't mind coming, they want to come to therapy, like, that's what we want. We want you to feel better. We want your end result to be returning back to wherever you were prior to level of your functionality, or you want to start to go back to play pickleball now because it's the new thing that everyone's doing.
Right.
So, it's little things, but it's little patient goals that we strive to get them.
So have you treated victims of motorcycle accidents?
I have. In fact, one of them was my husband.
Oh God! Oh, I'm so sorry to hear this.
He's okay though. A little hiccup.
When did this happen?
It was about 2 years ago.
Oh wow! Oh, I'm so sorry to hear this. So, how badly was he hurt?
Wasn't too bad. A little shoulder issue. He had a little bit more scrapes and stuff like that.
Yeah.
But he was okay.
Right.
He wasn't my favorite patient though.
So, do you see?
But I have had a couple others. But
Yeah.
he's the most special one.
The most memorable.
Oh yeah.
So, with respect to motorcycle accident injuries, do you see an injury that's more common than others?
I would say more upper extremity, shoulders, TBI, a little traumatic brain injury.
Right.
And thank God, we're in a state where helmets are required, because not everyone would wear them.
Right.
But, and the technology that has come with the level of whatever cushioning that they have in the helmet and stuff like that, and having regulations where you have to get them checked and registered every, I don't know how many years in between, but I think that has helped, not that everyone abides by it, but,
So I'm imagining that seeing these upper body injuries, usually shoulders and things like that you say, you have certain equipment in your office that's especially geared towards these kinds of things.
Yeah.
So can you talk about that a little bit?
So, I would say we're like a general outpatient physical therapy, but we do a lot of manual therapy because sometimes not everything can be fixed with exercise. Although I love exercising and I'm an exercise freak myself, not everything can be fixed with that. Sometimes you need to strengthen certain muscles because other muscles are stronger or taking the brunt for the weaker muscles that need to be strengthened in order to fulfill that normal gait pattern or lift your shoulder in the right way. So we have machines, we have TheraBands, we have cable column ropes, treadmill, bike. We have a spinal decompression traction machine, which is pretty cool.
Okay.
So some patients have really liked that. Not for everyone.
So when you first see a patient, I'm assuming you do like a full evaluation of the patient. And do you ask the patient, hey, I know you're hurt, but what is it that your goal is? Do you want to get back to doing something? Like for a motorcyclist, do you find out that they want to get back to riding?
Yeah. So another one of my favorite patients is my receptionist, Robin, who is a very passionate motorcycle rider. And she fell down the stairs last year and she fractured her shoulder. Oh man. And she's worked very hard to get to where she is, but her ultimate goal is to get back on that bike and ride.
Yeah.
And, you know, it's difficult because, like I said, a lot of upper extremity injuries happen with motorcycle accidents. But if you have just a general injury that's upper extremity, you need to be able to hold that motorcycle. And I know that they are not light.
Yeah. I mean, mine is about 800 pounds.
Yeah. So you need to be able to have the coordination, to have the strength, and to have the core strength for that too, you know.
So you're not even, I mean, if somebody wants to go ride a bike, you know, and they had shoulder surgery, it's not just the shoulder that you're concentrating on.
It's everything. I treat the body as a whole.
Right.
You can't just pinpoint and say, oh, okay, just the shoulder's hurting, let's just focus on the shoulder. Because above it and below it can be affected based off of the movement or the lack of movement that is happening.
Right. So if you want to get back into bike riding, that, you know, you want to get back on that motorcycle, you got to let your physical therapist know if you're in treatment. Yeah. And it sounds like in order for them to get out of pain, they should go to a physical therapist first even, you know, I mean, as opposed to like an orthopedist.
Yeah. I mean, the frustrating thing is we don't have the ability to send for an MRI or send for an X-ray. But at the same time, it makes our skills much better.
Right.
Because we rely on what we feel, what we see in our assessment to make a diagnosis.
Right. Right.
And then hopefully confirm that diagnosis with
imaging.
So
they used to say, at least because I used to volunteer as a paramedic, they used to say, don't treat the monitor, treat the patient. So I guess what you're saying is, okay, you can have an MRI that maybe shows a disc herniation or something, but if the patient is functioning perfectly fine, then what's the point? Like, you can't freak out just because an MRI shows that they have a disc herniation or something.
Right. And that a lot of that is also like how the imaging is explained to the patient, how the patient perceives that.
Right.
You know, if we get your MRI and we see like multiple disc herniations, right? So if the doctor was like, oh, hey, you know what? You have a disc herniation at this level and this level, this level, this level, and it's touching on this nerve and it's causing this. Or if you hear it based off of, you know, certain principles, or you say, hey, you know what? You have normal degenerative changes happening in your spine. You know, some of it is impinging on this side, which is why you might be feeling some of that. Something that could be treatable, something that can be fixed. And like, that sounds a lot better than the first one, where now people are Googling, what am I going to do with my cervical MRI?
Right.
It has this, and this on
Right,
it. Or
right.
ChatGPT, how do I fix this?
Right. And all of a sudden you get like, okay, surgical intervention. We're going to have to go in and like dig into your brain.
Right. So that I have a patient come in and they're like, Christina, do I need surgery? And I'm like, no.
Right.
Not always.
So,
surgery isn't always the answer.
Right. Right. I mean, physical therapy in and of itself, I think, is considered a conservative modality.
For the most part, yeah.
You know? And when we're saying that, it's not surgery. It's not so aggressive and
it's not invasive. Right.
Right. So, you know, I mean, surgeries have their own risks. And,
of course.
And things like that, and as does physical therapy. But I would imagine that the risks of physical therapy are a tad less.
But you know what? When patient needs surgery, then they need it. And guess who's there for them after surgery? We're there for them again.
Right.
So it's almost like a revolving door.
Right. So it sounds like it's just as important, if not more, to know a good physical therapist if you're going to do something like, you know, riding motorcycles, because if you do get hurt, and there is a chance, there's always a chance, right? So if you do get hurt, you have somebody to go to, right? Yeah. And, you know, it's, you know, it's pretty chancy out there. Like if you just kind of get hurt and say, okay, now what do I do? So it's good to have somebody in the Rolodex.
Yeah, I mean, especially we live in New York, so there's just 100,000 people driving around at all hours of the day. Congestion, you know, there's just more risk for things to happen. You know, my husband also, when he rides, he also does motorcycle racing.
Oh,
and he has convinced me that racing on a track is safer than riding on the street.
Okay, all right. Well, he's doing the Jedi mind trick on you.
Yeah, I mean, you know, I get it. But he's not really wrong. It's a controlled atmosphere. You know, you're just going 180 miles an hour, but it's still a controlled atmosphere.
Right. So, but everybody also knows what they're doing. They're going, everybody's in the same direction.
Correct. Exactly.
Everybody's turning the same way.
Exactly.
Everybody's trying to keep spacing.
Yeah.
Right. So
yeah.
it's a little less of a,
Yeah. But, it's a risk out there for sure.
Yeah.
And just being involved and seeing injuries, like I am more cautious as a driver, especially when I see a motorcyclist around. I keep my caution, I keep my distance. It's just, that's someone's mom, dad, brother, uncle, parent, grandparent, whatever it is. Like, they're humans and they're people too. Just because they want to go out and enjoy and ride doesn't mean anything bad from it, but you have to be careful.
So let's say a motorcyclist is hurt in an accident and they come to you. Tell me what they should not do when they first come to your office. Like, what would be something that you would say that is not advised to do if you want my help?
Ride on another motorcycle to come to me.
Yeah.
I mean, like I said, I won't send you away, but
Yeah, probably not a good idea. Probably not a good idea.
I don't probably take a painkiller and get behind a vehicle. I would say that would be a big no-no.
So if they come to you, is it okay to say, hey, I was riding my motorcycle and that's how I got hurt? Because I'm thinking maybe a motorcyclist would say, I'm going to be stereotyped and, the doctors are going to say, oh, okay, one of these motorcycle guys, and they're not really going to want to help.
I mean, some may say that. I won't, but some may say that. And, like I said, they're humans. They want to just enjoy their life. They want to live their life. If it's their body that they're risking, typically. Not always, but typically. But they shouldn't be shunned away because of that.
So do you find that people who come to you with motorcycle injuries, are they faster to recover, slower to recover, or basically the same as everybody else?
I mean, that's all contingent on the patient and their health in general, but it depends on what bike they ride. Right.
So I always find that or at least I feel in the communities that I ride with, that everybody wants to go bike riding, at any particular time they can. So they want to run home from work and they want to bike ride, and they want to, on the weekends, they'll blow everybody else off. And,
it's a lifestyle.
Right. So they want to get back on the bike as fast as they can. Yeah. So they want to, show up for physical therapy a lot more. And they're just so driven to get back on their bike.
Yeah. Yeah. It's a lifestyle, like I said, and it's therapeutic for people.
Yeah. Yeah.
And I think that's a big part of why people enjoy doing it. And it's a camaraderie.
Yeah, for sure.
And I didn't know any of this until I met my husband, really, and Robin.
Yeah.
But they're in two different worlds. He's on like a MotoGP world, and she's in, a Harley world, but like still very parallel in what they do and how they do it, and the relationships that they build because of it. And you have to trust someone if you're riding with them to make sure that they're looking out for you just as much as you're looking out for them.
100%. So as far as, paying for treatment, are there different kinds of hurdles that a motorcyclist might have in your office to work out a bill that, they might have to face from you? I mean, let's face it, you're providing a service and you're entitled to bill, right? I mean, everybody works for a living.
Right.
But also is the challenge of paying that bill. So I'm wondering how these motorcyclists go about paying their bills.
So unlike a motor vehicle accident where you have coverage that will pay for your personal injuries, motorcyclists don't have that in the state of New York. So we would either bill their insurance. If we don't accept their insurance, then we would have to place them on a lien, which means they would be responsible for payment after whatever settlement comes about, or they pay privately.
Right.
It's whatever they're comfortable with and whatever they want.
Or they could have health insurance too, right?
Right. If they have the health insurance and we accept it, that's fine. We take that. That's not a problem.
Right. So I guess the idea is to, before you bike ride, before you're out there riding motorcycles, it's a really good idea to have some sort of coverage.
Yeah.
Right? So it could be health coverage. And do you accept Medicaid? I forgot.
Medicaid I don't take.
Okay, but Medicare?
Medicare I take.
Okay, so there's coverage out there for everybody. I mean,
Yeah.
you don't. Some of them you have to pay for, some of them you don't. But
Yeah.
just be covered.
Yeah.
I mean, I think
God
that's
forbid,
really
you never know.
yeah.
Just never know.
So, well, that's really good to know that you welcome bikers into your office and into your
I welcome
community.
all walks of life for the most part.
So if somebody wants to, if somebody needs your services, I was in a motorcycle accident or any kind of accident, how do they get in touch with you? What do they do?
So you could find me on social medias, Instagram, Facebook. You find me on my website, Body Movement PT.com.
And I could put all that information down in the, it'll probably be below this video. So
Yeah.
I could put
Yeah, you
all
could
your
have it all
contact
there. Yep.
information. And
You would talk to Robin.
Uh-huh,
I have to give Robin a shout out on here because
Okay.
Without Robin, I wouldn't actually be able to be here. So she makes my life a lot easier. And thank you,
Excellent.
Robin. Kudos to being a motorcycle rider too. So
but they can call you too.
they could call me too. Yep.
Where do they call you at?
They could call me at my office. We have a 516-466-6164. And you can text me. I just don't know the number off the top of my head.
Okay, well, we'll put it. We'll put it down there.
We'll put it down on
yes.
there. We have a special texting number,
Yes.
so you guys could text us. It goes directly right to my phone. You can text me at all hours of the night. I don't care. I probably won't answer, just because I don't want to be responding to you at 3 o'clock in the morning when I
Right.
wake up to see it.
Right.
But feel free to send it.
But it sounds like you get motorcyclists who are injured in like really fast.
Yeah.
A lot faster than
the
calling
less time that they have in your office is just the more time that they have not being treated.
Right. And since they're coming to you like every other day or so, I mean, you really get to know these people.
Yeah.
Yeah.
Oh yeah.
Yeah, that's good. And so you can help them a little
And you
faster.
build relationships with them.
Right.
It's
Right.
and it's fun. I'm very fun at work. I like to enjoy and have a good time. I don't like to be very serious because that's not me. And I think a lot of people enjoy being comfortable enough where they can, relax, let loose a little bit. Like, it's okay. Like, you have a song you want me to put on? Go ahead. I don't care. If it's going to motivate you more, I'll play it all day.
Right, right. Well, I think you come from a place where you have your own set of values and your beliefs, and when that matches somebody coming into your office who really wants to get better, then it's a good fit. It's a good fit. So it sounds to me like getting back to your family is more important, and having a family is important. And it doesn't matter how these people look. They could wear the tough guy leather or have long hair. You just want to get them back to doing what they're doing.
Exactly.
Yeah. All right. Well, I really appreciate you taking the time to
Thank you for
come
having me.
here. And certainly, I know how busy you are, and I know you have a lot of patients right now waiting on you.
It's all good.
So really appreciate you taking the time to
Thank you for
join
having
us
me.
and
Appreciate it.
talk about what you do.
Yeah, cool.
Okay. Thank you.
No problem.
And that's a wrap for this episode of Riding Counsel with Richard Jaffe. Thanks for tuning in. If you enjoyed the ride, be sure to subscribe, leave a review, and share with your fellow riders. Until next time, keep the rubber side down and ride safe.